Hey guys, this month I'm going to talk about what it looks like to be on call as a medical missionary doctor. So here's a day in the life of a medical missionary doctor. Just a disclaimer, some of the stories and some of the images are sensitive, so parents may want to watch this before younger viewers do. My day typically starts around 5:30. I wake up, read my Bible, spend some time with the Lord, enjoy the peace and quiet, eat breakfast, and then around 8 o'clock head into the hospital for rounds. The morning that I walked in, it was a foggy day, so I couldn't see the mountains. Many days I look up and I can see the mountains all around me. I walk by our kids' school as I walk into the hospital. On weekdays, first thing when I get on the hospital grounds, I look up and I can see the big long line of outpatients who are all checking in to be seen for the day. On the weekend, the line is much shorter. So on weekends, there is one medical doctor on call for the entire hospital. So that's pediatric ward, medical ward, labor and delivery ward, nursery, emergency room, and all of the cesarean sections, all for one medical doctor. So it's very busy. I started my day rounding in our pediatric ward. I saw about 15 pediatric patients. Some patients were thankfully improving after being treated for pneumonia or gastroenteritis and doing better and getting ready to be discharged. There was one young baby that had had a chop to the head with a domestic altercation. There was another child that I pulled a pericardial drain, or a drain that was around his heart. There were multiple children that were being treated for neonatal sepsis, for bacterial meningitis. There were kids who were being treated for malnutrition, for respiratory illnesses, for pneumonia. And so I walk down and I see one child at a time. After rounding in our pediatric ward, I headed down to our labor and delivery ward. And the first patients that I cared for in our labor and delivery ward were all of the nursery babies. So I saw somewhere between 15 and 20 nursery babies. The nursery here cares for kids who are born very premature. And so some of these kids are only a kilogram or 2 kilograms. And we go from child to child, and I adjust their feeds, I adjust their warmth, their lights to decrease their bilirubin, adjust their antibiotics, and we care for these extremely young and fragile lives. After rounding on the nursery babies, I went over to our antenatal area, and this is where I care for and see moms who are pregnant but have not yet delivered their babies. And so some of the things that I cared for were moms who had preeclampsia, moms who had infection, moms who had went into labor early, and we were doing things to try to slow down the labor and to help the baby's breathing and development before they deliver. I do lots of ultrasounds during my antenatal rounds because many moms here don't know exactly how far along they are in pregnancy, don't know how big their babies are. None of them have had first trimester ultrasounds, so it can make dating a pregnancy challenging. But ultrasound is a very helpful tool to be able to see how big a baby is, to make sure that the baby's head down, and to make sure that there aren't twins, and to make sure that the baby is doing well. While I was in the antenatal area, I cared for one mom who had had multiple previous cesarean sections, and she was at term in labor and would need another cesarean section. So I called up our OR and I told them, get ready, we're gonna have another cesarean section in a little while, and the staff came in to start prepare the operating room. After rounding on about 5 or so antenatal mothers, I went over to our postnatal area, and this is where we care for moms who have already delivered their babies. So some of the things that we see moms who have had postpartum hemorrhage and who are anemic, moms who have had tears during the delivery and will need repairs, moms who are having infections or other issues, and we just check on all of our moms who have had cesarean sections or other procedures and make sure that they're doing well. At this point, I had finished the rounds in the pediatric ward, the nursery, the antenatal moms, the postnatal moms, and I went over to the emergency department. When I walk into the ER, one of the first things I do is I look to see how many charts there are out of patients for the doctors to see. And so some of the patients that I saw that day, I saw a 7-year-old girl that had been drowned in a nearby river, and we resuscitated her and admitted her to the hospital. I saw a man who had been chopped to the hand with a machete, and he had tendon injuries and fractured bones from the machete. I saw a young teenage girl who was having a lot of trouble breathing, and I got an x-ray on her, and she had a huge pleural effusion, or fluid that accumulated outside her lung. So I got everything set up to do what's called a thoracentesis, where you put a needle in and you drain all of the fluid from around the lung. In our setting, this is almost always caused by tuberculosis, so I started her on tuberculosis medications, and she was doing much better and was able to discharge her from the emergency department. After finishing the thoracentesis, I got a call that there was an emergency over on the medical ward. So I went over to the medical ward. I walked in, I went behind a curtain, and I saw a young man who was dead and had died from sepsis. I talked to his brothers. I pronounced him dead. I prayed with his brothers. After praying with his brothers, I was walking back to the ER when I got notified that the operating room was ready for the cesarean section. So I walked in and got prepared, scrubbed in, and did a cesarean section for this mom and a tubal ligation, which she had requested.
Well, pressure for me? Stand down. Good job.
So at this point, after finishing rounds, after caring for patients in the emergency department, after doing a cesarean section, it was about 2 o'clock. And so I tried to head home for a quick lunch. While I was walking back, I saw my daughter Evie climbing in a tree nearby the hospital and spent a few minutes with her. I went home, I ate a lunch quickly for about 30 minutes, and then I got a call that there were more patients in the ER that needed care. I walked back to the ER. I cared for a young girl who had these swollen extremities and a condition called Henoch-Schönlein purpura, got her admitted to the hospital. After that, I saw a young boy who was breathing really quickly. He was about 3-4 years old, and did a workup on him and discovered that he was severely anemic with a hemoglobin a little over 2. We sent off a bunch of tests in our area. Sometimes that's because of malaria. Sometimes that's because of cancer. Sometimes that's because of other infections or malnutrition. For this child, I think it was ultimately probably because of intestinal worms. But because of his anemia, we got him going with an emergency blood transfusion, got him admitted to the hospital. After that, cared for a man with a stroke. After that, a car pulled up and this boy was carried from the car. He was a boy that had been walking along the side of the road and had been a pedestrian versus motor vehicle. So another car had hit him. He was a trauma. He had a shattered tibia, shattered fibula, multiple injuries that you could see right away. After caring for him, I cared for a woman that had a large swollen tumor of the face. And then I had one of my more memorable patients from the day. I had a patient who was about 50, and she came in with pelvic bleeding. And as I went to do her exam, I saw that unfortunately she had this enormous cervical mass. So she had cervical cancer. I did an ultrasound and I looked at her kidneys, and her left kidney was all swollen up. And in the setting of cervical cancer, that's because the cancer has invaded and obstructed the ureter and the kidney gets backed up. It's essentially a terminal diagnosis in our setting. So I talked to this sweet woman. I told her why she was having pelvic bleeding. I told her that she had terminal cancer. I asked her about her faith. I asked her if she knew Jesus, and I could tell that she did. I could tell that she authentically loved the Lord, regularly went to church, had a wonderful relationship with Jesus. I asked if I could pray for her. I prayed for her, and after I prayed for her, she took my hand and she told me, "Thank you so much for being here in Papua New Guinea. Thank you for coming to serve us here." And I had just told this lady that she had terminal cancer, and she was thanking me for being there. And I had to choke back the tears. But these are some of the interactions that happen and some of the blessings of getting to be a missionary doctor and care for the beautiful people here in Papua New Guinea. At this point in time, it was pretty late in the evening, around 8 o'clock. And so I walked back home for dinner, ate a quick dinner, and then not long after that, got a call that there were more patients in the emergency department to see. I walked back to the ER, and one of the first patients I saw was a man who was having chest pain. I got an EKG. I could tell right away that he was having a heart attack. In the US, a heart attack patient would be rushed off to the cath lab where they could have a life-saving stent put in. In Papua New Guinea, there is one cath lab in the country. It is a plane ride away, and it is not something that our patients can have access to. So we do the best that we can with medications. So I went out to the pharmacy, I gathered medications for him, some of which were expired, but they are the best thing that we have. And so I started him on medications for his heart attack. His chest pain went away, and he was sitting up in bed, he was talking, he looked really quite good. I then got a call that I was needed over in D ward, our labor and delivery ward. I went over there and there were multiple moms to see. One mom was a mom who was at term and had been pushing for a long time but couldn't get the baby out, and the question was whether or not she would need a cesarean section. The next mom that I saw was a mom that had a fever and a high heart rate, and her baby had a high heart rate, and she was at term in labor as well with fetal distress, and the concern was that she might need a cesarean section. And it turns out she has malaria. We got her on treatment for malaria. After that, I saw another mom, and when I did her ultrasound, I saw the baby's head down in the pelvis, but then below the baby's head was the umbilical cord and a hand in the bag of waters. So as mom was in labor, what was about to happen is that her bag of waters would break, and then a hand and a cord would come out, which would be an emergency situation. So she was the mom that most urgently needed to go for a cesarean section. So we took her over, we did her cesarean section. It was quite a challenging cesarean section, but everything went well. Mom did well, got baby out. Just as we were closing up her cesarean section, I got a call, and they told me that the patient that I had admitted with a STEMI, with a heart attack, was in cardiac arrest on the medical ward. I wrapped up in the OR as quickly as I could and headed over to the medical ward. I was just finishing, kind of wrapping up the cesarean section when I got a call from another nurse saying that the heart attack patient that we admitted was in cardiac arrest over on the ward. So I walked over to the ward, and he had been getting CPR for about 15, 20 minutes, had not had a defibrillator or some of the other basic things that we do in the United States. But at that point, with a massive heart attack and 20 minutes of CPR, I pronounced him. And I'm just sitting here thinking about the one life, the baby that came into this world, and this gentleman that his life ended this morning. And just tough, because I know that in the US there would have been a lot of things that could have been done to save this gentleman's life, and I'm just feeling sort of the sense of disparity and sense of difference of what happens here. Yeah, so that's tough. Don't really know exactly how to feel when you have one good outcome and one where I wonder if things could have gone any differently. But yeah, night on call, and it's 2 a.m. and still some time to go. At this point, it was around 3 a.m. and I walked back through the twilight, through the stars, went home to bed, tried to calm down enough to get a few hours of sleep. Woke up at 7 o'clock the next morning. We have to round on the day after our call shift, so we go in for rounds that following morning and can then go home. So I walked back to the hospital. It was a bright, crisp day. I could see the mountains all around. I was tired, but doing okay. Walked back to the hospital, rounded, and thankfully could see that some of my patients that I had seen the day before were doing well. A baby that had been in the nursery on oxygen that I had induced to be delivered prematurely because mom had severe preeclampsia, that baby was off oxygen, was doing much better. The kid that had severe anemia that looked like he was fighting for his life the day before was sitting up in bed eating a banana, looking like a perfectly normal, healthy kid. After finishing rounds, I walked home, and while I was walking home, I saw our kids out on the basketball court playing dodgeball. So I had to stop and play dodgeball with them for about 5 minutes, which was a fun way to end my call shift. So this was a whirlwind summary of what a day on call looks like as a medical missionary doctor. It can be exhausting at times, but it's also very rewarding. There are highs when you see kids who have lives saved and people who have good outcomes and people who are just so incredibly grateful for the care that we get to provide. I get to work with a fantastic team of other caring, loving, Christ-centered, fantastic doctors who really care about serving people here and are just excellent clinicians. We have lots of highs, but we have lots of lows of long hours, lots of patients, tough outcomes, pronouncing multiple patients dead. But this is what a day in the life looks like of a on-call medical missionary doctor. So thank you all for watching, and I really want to say thank you to everyone who is supporting us and supporting the work that we're doing here. We could not be here doing what we're doing were it not for you, were it not for your love, were it not for your support, were it not for your prayers. It can be lonely sometimes, and so we're really grateful for all of your comments. We're grateful for your messages, and we're grateful for all of you who follow along and continue to pray for us. Have a great day. God bless. Bye.